Good afternoon. I'm James Mallory. I'm chairman of the Iredell County Board of Commissioners, and I'm here to give you an update on our status with COVID-19 and to give you some context. When we first started these video discussions of the challenges that lay before us, that was back in March of 2020, and since then, we've endured 2 full surges, and we're in the midst of a third. And I'd like to give you a little bit of current data, and then a look back to put where we've been and where we're going in context. We presently have had 22,306 confirmed positive cases of COVID-19 in the county. That really puts us middle of the pack when it comes to our surrounding counties. Their situation per capita is very similar to ours. But to give you an idea of current increases, yesterday we had an increase of 135 positive cases. We have a current number of 88 that are hospitalized in Iredell County hospitals. Now, that does not reflect just Iredell County citizens. Iredell County is a regional health care provider, and Alexander County, for instance, does not have a hospital. So when you break out Iredell County residents out of that total of 88, 68 are from Iredell County and 20 are from some other county surrounding Iredell. The purpose of our initial discussions over a year ago was to see how we could, as a country and a community, bend the curve to be able to avoid spikes in infections that would lead to hospitalizations and potentially death. And we have had a mixed bag of success as that goes, but in the main, Iredell County has been able to avoid overtaxing our healthcare systems. And if you look back over the past year and a half, you can see that by week, our cumulative totals, you can very easily see the 3 surges that occurred in terms of infections. Now, these numbers reflect those confirmed cases. There are a number of folks who had COVID exposures that were asymptomatic or that did not report or have the cases actually confirmed by tests. And it was determined by the CDC that the multiple of the initial COVID variant to capture those folks that did not actually get a test was about 2.1. And what that means is that if you reported 10 cases, that you actually had probably 20. Now that's an estimate, but that gives it's a good planning number to look at. As you can see, the numbers after the second surge over the winter months dropped precipitously and then fell to a level that was not seen except prior to the first surge. So it was that time in the spring and the summer that we thought that we had turned the corner and saw the light at the end of the tunnel. Unfortunately, the light at the end of the tunnel is not the end of the tunnel. It's more like a train. So we have to take some actions to get out of the way of this train so that it doesn't run us over. What made a significant difference after the second surge over the winter months was the introduction of the availability of a vaccine. Prior to that time, the only defense that we had were masking, maintaining social distancing of 6 feet, and washing hands frequently, and trying to avoid settings in which the virus was going to be particularly communicable and people vulnerable. And we especially wanted to protect those who were most vulnerable, over 65, or who have underlying immune conditions or other medical conditions that have rendered them immunocompromised. So as I say, even though the numbers went up, in combination with the introduction of the vaccine, which if you look at a chart, you can see how the number of weekly increases peaked out around late January, just about the time that we started being able to get vaccine clinics up and running, and the vaccines from Pfizer and Moderna distributed or administered to folks beyond our healthcare workers and those who were at extremely high risk. And throughout the following months, a lot of people in Iredell County got vaccinated, but not as many as we need. Iredell County has lagged the state averages by, on average, about 10% in terms of numbers of folks vaccinated. So where we currently are at around 41% of our population being vaccinated, the state of North Carolina is around 50 to 51%. So we are behind the curve in terms of being able to get folks vaccinated. And we need to put a full court press on getting as many people vaccinated as possible. And I'll go into the reasons for that in a little bit. They'll become evident. The data that we have, and I'd like to share a contrast between the data that was present at the beginning of the second surge that we had in December, on December 18th, and the data that we have today in the midst of this third surge. The surges that we've had, if you go back and look at the duration, the first surge in the summer of 2020 was really about 8 weeks long. The surge we had in the winter months, beginning in December or early January and concluding in late February, were really about 12 weeks in duration. So the upshot is the surge was higher the second time around, and it was of a longer duration. And when it settled back to a baseline of an infection rate and hospitalization rate, it was a higher baseline than what we had when we that had preceding the first surge. So the numbers, if you look at the Iredell County data as of August 26th, were back in December, we had a total of about estimated 16,955 folks that had been exposed to COVID and contracted COVID. We expect that the current number is around 93,000. Now, Iredell County has a population of 185,000 folks. I think some numbers that these percentages are worked against uses 181,000, and that's a previous number. But currently, we think about 93,000 had been unreported, and 22,000 have been reported. The multiple that I talked about earlier of 2.1 to try to capture those numbers that had been exposed, contracted it, and did not report it or get tested has risen due to the Delta variant from 2.1 to 4.2. And that is a reflection of just the greater degree of transmissibility and infectiousness that the new virus variant has. So we're really looking at two very different circumstances. It is quite simply twice as easy to communicate and to contract COVID-19 today as it was back in the winter months or in last summer. But we've been vaccinating folks, and the number of folks that have been vaccinated is about 75,000 Iredell County residents. That is total population, and that represents about 41% of our total population. Now, the percentage of the population that has been exposed and contracted it, whether it was tested or is estimated, is about 64%. Well, that's more, 64% and 41% is obviously more than 100%. Well, there's a number of folks that have contracted it who have been vaccinated. So there's some overlap there, and we do not know what that number is. But we do know that a healthy number of folks have contracted the virus already, but the majority of those are not vaccinated and are therefore more vulnerable. The current hospitalization rates, and if you look at the chart that has our weekly average, this is really the most important metric that we have because it is focused on what our pacing item is, which is the ability of our hospitals to be able to provide the needed care for folks who are hospitalized due to COVID-19 or any other illness for that matter. And if you look at the hospitalizations are a little about a week to 2 week lagging indicator behind when cases are reported because people are getting sicker along the way and then they decide to come in to the hospital. And once again, if you look at the numbers beginning in, it looks like June 21st, where we had an average of about 13 folks, this is 2020, in the hospital on an average. It went up to just under 30, to 29, and then dropped back down to 12.6 by August the 16th. So roughly 8 weeks for that hospitalization spike. And then it bounced around between, in the teens and the 20s until late November, early December, when we bounced around between 29.2 and then ended up at 30.8 over a 4-week period. And then it shot up, and for 12 weeks, we were as high as 72 hospitalized in Iredell County. Now that 72 number is total in county and out of county, and we didn't have the breakout available at that time. We've subsequently been able to break that out about who is a county resident and who's not. But the total demand on our healthcare system was 72 folks hospitalized at its peak. And then it dropped down fairly precipitously, and if you look at that decline and you look at the number of vaccines that were being administered over that time period, you can see that vaccinations had an impact in not just the rate of infection, but also in the rate of hospitalization. From then on, it bounced around, as I said, between 10 and 20 in the hospital, which is was able to be handled very adequately by our healthcare providers without overtaxing them. But understand this, they've been in this fight for, a year and a half. This is, and while it waxes and wanes for the general public, they're in the fight every day. And this is wearing on them. And it is a difficult thing to be able to be providing care to someone in ICU who is on a ventilator and is more likely to expire and pass as a result of their stay due to the critical nature of their impacts of the disease. So from March all the way into late June, we bounced around in that 10 to 20, and then we dropped way down. We actually averaged 1 week less than 2 in the hospital, and that's where we thought, hey, we've seen the light at the end of the tunnel. Well, that didn't last long till we heard the whistle of the train, and at this point, the numbers have risen faster and further than the large surge that we had in the winter months. What's particularly troubling about that is that that is occurring during a time when 41% of the population is vaccinated. So the at-risk folks that are going to the hospital are the unvaccinated, whether they've had the virus or not. And so that's why it's so important. At this time, over 80% of the folks in the hospital are unvaccinated. That represents a significantly larger number as a percentage than they represent as the general population. And of course, it includes children under 12 who aren't able to be vaccinated, and it also includes 12 to 18-year-olds, which have a pretty small vaccination rate. It's around 15% of those eligible. So that just means that the folks in the hospital are coming from a smaller group of folks, and the numbers are greater. So they're at greater risk of going to the hospital under the Delta variant scenario. Presently, if you look at the duration of the surges in the past, if it's as short as 8 weeks, we might have another week of increase, and then it would go down just about as quickly as it happened. On the other hand, if it's a 12-week surge like we had in the summer, in the winter months, who knows where this may end up? If the trajectory on the graph, as you can see, is going to put us up to 120 or 130, we're going to be in a world of hurt. So we hope that if it's a longer duration, that it will basically top out and maybe remain fairly static before it drops. So we don't know whether this is going to be a sharp peak or whether it's going to be a plateau. But a lot of that is up to what you do. And if you're going into battle against this virus, it's like two medieval armies lined up against one another. Everyone's seen all the movies, and what do you see? Well, you see people going into battle, and they've got armor on, they've got a helmet, they've got a shield, and they've got a sword. And then they go do battle. Well, we're battling a virus, and to be effective, you need all of those elements that those soldiers have. Well, the armor that you have is essentially, the 3 W's. It's the washing your hands, maintaining social distancing, and masking is your shield. And if you've got those three elements, you are less likely to be wounded, but you're not able to take the fight to the virus. For that, you need a sword. Well, your sword is the vaccine. And we have news this week that the Pfizer vaccine has been fully FDA approved. There's a number of people that have been reticent about getting vaccinated because all the vaccines have been approved under an emergency use authorization. This week, fully FDA approved for age 16 and above to take the Pfizer vaccine. It's anticipated that within the next 30 days or so, that both Moderna and J&J, who have also applied just recently for full authorization, could well be likewise approved. Then that means that we all have a sword that is highly effective, in excess of 90% in terms of being able to prevent serious disease. That doesn't mean that you're not going to get wounded in battle. You're going to get nicked, but if you're wearing a mask, you got a shield. If you're maintaining social distancing and you're washing your hands, you've got some armor on. So what kind of kit you put on is your personal decision, and you need to evaluate the risks of the environment in which you function. And so that's all up to our own individual choices. But choices result in consequences. And if you aren't wearing any armor, if you don't have a shield, but you do have the sword, then you're going to be able to ultimately prevail over the virus. You're going to be able to wound or kill it or drive it off. But you're going to get nicked up in the process. If you're wearing all that equipment and you've got a shield, then you're in the best position and you got a sword. You've got the best of all the worlds put in a package. So we need you to consider, with the change in the demonstrated effectiveness and safety of the vaccine, that you get the jab as soon as you possibly can, because we don't know how long this surge is going to last. And the sooner you get it, the shorter in duration and the lower the peak will be. The last slide I'll show you is the one we desperately want to avoid, and that is a death rate, the number of deaths. As you can see, we had 24 deaths in 1 week of the second surge. Those numbers have been coming down, but death is a lagging indicator. It doesn't happen until after hospitalization for usually a week or 2 or 3, maybe longer. But as you could see from the rate of hospitalizations, our death rate is unfortunately going to present itself. It's too late to take a vaccine when you're in the hospital. So get your vaccinations now. We'll give another update as the situation changes. I will say that as a result of this increase, some time ago, back in the spring of 2020, the county offices had a mandatory masking requirement under certain circumstances, as well as the general public that were coming in to use the services that the county provides in all of our departments. And I'm very proud to say that all of our departments were open for business. They never closed their doors. They operated safely for both themselves and for the general public with what they had. And back then, all they had was the suit of armor. They didn't have a sword. They did have a shield, and that was a mask to protect themselves and, more importantly, to protect others. Well, today, we rescinded that masking requirement back in the spring, in mid-May, when our numbers had come down to the point where it looked like we could just be back to business as usual with everyone taking basic precautions based on their own personal situations. Some people have elderly parents that live with them or someone that's immunocompromised, and they have to take greater precautions as a result of that. But because of the significant rise that we've had in infections and hospitalizations, effective tomorrow at 8 o'clock, I have signed an order to reinstate the masking requirement in Untitled County offices for the protection of our workforce and the ability to preserve the ability to provide services to our citizens and to protect the general public. That will, as I said, be effective Friday, tomorrow at 8 o'clock. And we would ask that you understand and help us to help you. In the meantime, good luck, God bless, be safe, and God bless America.